Okay, good morning. So today we will have a look at the neck. So we're going to concentrate anteriorly first. Let's have a look at the muscles first, so that it'll be easier for you to understand when I talk about the boundaries of the triangles. Okay, let's have a look at the infrahyoid muscles first. Here you can see on the right side here. On the left side, most of the infrahyoid muscles have been removed. So let's have a look at the right infrahyoid muscles first. Okay. So the infrahyoid muscles, can you see this muscle here? You can only see a small part of it because it is deep. And this is the sternothyroid muscle. It is deep to this muscle. This is the sternothyroid muscle. Okay, and posterior to that, posterolateral to the sternothyroid muscle, you'll find this muscle. This is the omohyoid muscle. This is the superior belly of the omohyoid muscle. Okay, this is the hyoid bone. Okay, this is the hyoid bone. So it's attached to the hyoid bone. So this is omohyoid bone, superior belly, and this is the inferior belly of the omohyoid bone. Inferior belly of the omohyoid bone, superior belly of the omohyoid bone. Okay, and posterolateral to that, here you can only see small part of this muscle here because it is deep to the omohyoid muscle. This is the thyrohyoid muscle. Thyrohyoid muscle. Okay. Okay. And this muscle here, laterally in the lateral neck here, this is the sternocleidomastoid muscle attached to the mastoid of the temporal bone over here. This is the sternocleidomastoid muscle. Okay. Okay, now let's have a look at the suprahyoid muscles. Suprahyoid muscles over here. So this is the hyoid bone, and here is the suprahyoid muscles. So you can see here this muscle here. You can only see the right side. On the right side, the left side here they have removed that muscle. So this is the digastric muscle. Digastric muscle. This is the anterior belly of digastric muscle. Okay, this is its posterior belly. Posterior belly of digastric muscle. Again, anterior belly of digastric muscle, and its intermediate tendon here pierces this muscle. And this muscle is the stylohyoid muscle. Stylohyoid muscle. Attachment here is styloid process of temporal bone to the hyoid bone. So this is the stylohyoid muscle that is superior and anterior to the posterior belly of digastric muscle. Okay. So now let's have a look at this muscle here. You can only see on the right side only. The left side has been removed. The left side has been removed. We can only see on the right side only this muscle. It is deep to the anterior belly of digastric. This is anterior belly of digastric, deep to the anterior belly of digastric. Here you will see this muscle. This is the mylohyoid. Mylohyoid. On the left side, the mylohyoid muscle, anterior belly of digastric muscle have been removed. So we can see a deeper muscle here, also suprahyoid muscle, that is the geniohyoid. Geniohyoid. Okay, now let's have a look at the triangles in the neck. Okay. The anterior anterior triangle of the neck, the boundaries of the anterior triangle of the neck is the midline of the neck, midline of the neck, and then the anterior border of the sternocleidomastoid muscle, okay, anterior border of sternocleidomastoid muscle, midline of the neck, and inferior border of the mandible, and an imaginary line from the angle of the mandible to the mastoid process. So that's the anterior triangle of the neck. The anterior triangle of the neck is further divided into 4 smaller triangles. Okay, firstly, here is the submental triangle. Submental triangle boundaries are the anterior belly of digastric muscle on both sides. So on the left side here, there's no anterior belly of digastric muscle, but just imagine there is an anterior belly of digastric muscle here, and the base of that triangle is the hyoid bone here. So that's the submental triangle. So the mylohyoid muscle is the floor of this submental triangle. Okay, and now let's have a look at the submandibular triangle. This is the submandibular triangle. Boundaries, anterior belly of the digastric muscle, anterior belly of digastric muscle, posterior belly of digastric muscle, and the inferior border of the mandible. So this is the submandibular triangle. So you can see there's the submandibular gland in the submandibular triangle, and here you can see this is the facial artery in the submandibular triangle. Okay, now let's have a look at the carotid triangle. Carotid triangle, the boundary is the posterior belly of digastric muscle, anterior border of the sternocleidomastoid muscle, and the superior belly of omohyoid muscle. So this is the carotid triangle. Most important structure is the carotid sheath, and its content here you can only see the artery here. Common carotid artery, external carotid artery here, and that's the internal carotid artery. We'll have a look a little bit more detail on the arteries on the other side. The other side is much more clearer because they have removed the sternocleidomastoid muscle. Okay, now let's have a look at the 4th triangle in the anterior triangle of the neck. Okay, muscular triangle boundary is the midline of the neck here, and then the anterior border of the sternocleidomastoid muscle. Another boundary is the superior belly of the omohyoid muscle. Okay, boundary superior belly of omohyoid muscle, anterior border of sternocleidomastoid muscle, and midline of the neck. You can see in this triangle there's the trachea here, thyroid gland here, and the thyroid cartilage, part of the larynx here, and in this triangle you also find the infrahyoid muscle. This is sternohyoid muscle, and deep to that is the sternothyroid muscle. So that's the muscular triangle in the anterior triangle of the neck. Okay, now let's have a look at the posterior triangle of the neck. Okay, posterior triangle of the neck. So this is posterior triangle of the neck in the lateral region of the neck. It is posterior to the sternocleidomastoid muscle. This is sternocleidomastoid muscle. On the surface of the sternocleidomastoid muscle here, you can see a vein. This is external jugular vein. Now let's have a look at the boundary of the posterior triangle of the neck. Here should be a clavicle here. They have removed the clavicle. So the boundary is middle third of the clavicle, and then the trapezius and the posterior border of the sternocleidomastoid muscle. So this is the posterior triangle of the neck. Apex is at the occipital bone. Okay, you can see that the floor they are formed by muscles. Okay, firstly, here you can see. So we are looking at the posterior triangle of the neck here. And the floor is formed by the here anterior scalene muscle, middle scalene muscle, posterior scalene muscle. You can see only small part of it here, posterior scalene muscle, levatoscapular muscle. You can see on the surface of the levatoscapular muscle here, there's a nerve. This is spinal accessory nerve. And then posteriorly here is the splenius capitis. Okay, splenius capitis. And this is the trapezius muscle that forms the boundary of the posterior triangle of the neck. Okay, now let's have a look at these nerves here. You can see these nerves. These are the superficial branches of the cervical plexus. These nerves here, they are the superficial branches of the cervical plexus, and you can see it emerges from the posterior border of the sternocleidomastoid muscle, and this is called the Earth's point. Nerve point in the neck, Earth's point, and you can see, okay, this nerve is the lesser occipital nerve, going to the occipital bone. And this is the great auricular nerve, going to the auricle, great auricular nerve. And this is transverse cervical nerve. And superficially going down here should be supraclavicular nerve. And I've mentioned earlier just now on the levatoscapular muscle here, there's a nerve. That's the spinal accessory nerve. Okay, let's have a look on the other side of the neck here. Okay, they have removed the sternocleidomastoid muscle. They have removed most of the infrahyoid muscle, so we can see it clearly artery here and the brachial plexus here. So let's have a look at this part of the neck. So you can see they have removed the sternohyoid muscle, sternothyroid muscle, and the omohyoid muscle. Only left here is the thyrohyoid muscle, attachment to the thyroid cartilage here and the hyoid bone. So this is the thyrohyoid muscle. Okay, and then the artery here, this is the common carotid artery. Common carotid artery, and you can see up here it divides into two. It divides into two. This is external carotid artery, and posterolaterally here is the internal carotid artery. Okay, this is internal carotid artery, no branches in the neck. But external carotid artery here, it has branches in the neck. Okay, the first branch here, you can see this branch is the superior thyroid artery. You can see it's going down to the thyroid. Superior thyroid artery going down and supplies the thyroid gland. Okay, and there's a small branch. You can only see small part of this branch here. This is lingual artery. Okay, and above that here you can see a branch here. This is the facial artery. Facial artery. Okay. And posteriorly here, can you see this branch? This is occipital artery. It goes behind the mastoid process of temporal bone here. And it will emerge at the occipital bone here. So this is occipital artery. Okay, again external carotid artery, and you can see it divides into, it gives off two terminal branches here. Here can you see? This is maxillary artery, and this is the superficial temporal artery. Okay, so that's the branches of the external carotid artery. Now let's have a look at the structures that you can see. Okay, here you can see subclavian vein. This is anterior scalene muscle, and that forms the floor of the posterior triangle of neck. You can see it clearly now because they have removed the sternocleidomastoid muscle. So this is anterior scalene muscle, and you can see there's a nerve on its surface. Okay, that nerve is the phrenic nerve. Phrenic nerve. Okay, posterolateral to that muscle is this middle scalene muscle. In between the anterior scalene muscle and the middle scalene muscle, you'll find brachial plexus here. You can see a trunk of brachial plexus. And this is artery. Over here is artery, subclavian artery, third part of subclavian artery. Okay, I repeat. This is subclavian vein, anterior scalene muscle, third part of subclavian artery, brachial plexus, and this is the middle scalene muscle. You can see there's a part of the cervical plexus on the middle scalene muscle. And then posterolateral to that, here you can see muscle here. That's the posterior scalene muscle. And posterior to that, here's a muscle levatoscapular muscle. And lastly, posteriorly, there's the splenius capitis muscle, muscle of the back of the neck. They have removed the trapezius. That's why we can see clearly the splenius capitis and levatoscapular muscle. Okay. On the right side here, we still have the trapezius. So it covers some part of the splenius capitis and levatoscapular muscle. Okay, that's all for this model.